In today's Doctor on Call, we're looking at the topic of hospice care and when might be the right time for a patient and their family to consider it. Dr. Brandon King from Monroe has some things to think about during this tough transition.
Hello, I'm Dr. Brandon King. I'm a primary care physician, but I also serve as the concierge doctor at Monroe. One of the specialties that I have is in hospice care. And so in these talks, I want to help answer some questions that you might have about hospice care. And so the question we're going to answer today is, when is it time to consider hospice? Well, this can be a difficult decision. Oftentimes this is brought up by a physician with the patient. Some of the times we'll also see other healthcare professionals that will bring it up, such as a home health nurse, maybe even a social worker at the hospital. But my goal is, after listening to this talk, that you'll be more familiar about when it is time to consider hospice for yourself or for a loved one. So there are three things that we look at when we consider if a patient is appropriate for hospice. Number one is they have some form of terminal illness. Now, a terminal illness would be one that would be a disease process that, if it runs its normal course, then we would expect a life expectancy of less than 6 months. Number two would be that a patient is declining in their overall health despite aggressive treatment or despite the appropriate medical treatment. And number three is they are just ready to be made comfortable and want to forego some of those life-saving or life-prolonging treatments. So what are some of the diagnoses that people are on hospice with or for? Now, back in the 1970s, you would see that the majority of people on hospice would have a cancer diagnosis. Well, nowadays, less than 50% have that cancer diagnosis. And instead, we see more end-stage disease processes such as heart disease, lung disease, and kidney disease. Also, we see a lot of patients on service with dementia, whether that be Alzheimer's, a vascular dementia, or maybe even a Parkinson's type dementia. Now, some of the things that would tell us that a patient is having a decline in overall health would be the following. The first would be a decline in just their cognitive abilities. These cognitive abilities would be like memory, would be orientation, maybe even an incontinence of bowel and bladder. Weight loss is another thing that we would see, and you typically would go along with a decrease in appetite. Other things would be an inability to perform some of the activities of daily living, such as cooking, cleaning, toileting, bathing, etc. We'll also see a decrease in ambulation, and perhaps even an increased weakness and fatigue is evident by them sleeping more during the day. So those are some things that you can look at, and hopefully what you'll realize is that we can start the process of providing hospice care much earlier in the disease process. And the goal would be to provide more quality of life in those final days, weeks, or even months. So what are the benefits of hospice? Well, I'm glad you asked. We're going to discuss that in our next talk. I hope you found this information informative and helpful. I appreciate you tuning in, and I hope to see you next time.